beautiful day out, so you can understand where our attendance is. And that's why we're going to have an awesome recording for you to view on YouTube. So greetings, my name is Kat Steele and I will be moderating this session. I would like to start today's webinar out with a quote. Sometimes you don't realize the weight of something you've been carrying until you feel the weight of its release. Thank you for being part of our wellness community. And we realize that despite your busy schedule, you've opted to join us and participate in this webinar to help yourself, your family, and your community live healthier lives. Last webinar, we discussed freedom from autoimmunity. To view our previous webinars, you can check out our YouTube channel and get reminders. You can hear about, I'm sorry, I'm echoing a lot. Is there a way, I'm not sure why it's echoing so bad. Once you click the PowerPoint, it changed to an echo.
Yeah, I'm not too sure why it's echoing actually. I can reduce the volume if that would help.
Thank you. Okay. Hopefully that works a little bit better. So you can see our YouTube channel, subscribe to our YouTube channel to get reminders and to hear about our upcoming webinars. That seemed to work perfectly. Thank you so much. Please go ahead and give us a follow on Instagram or on Facebook, where you can also get updates. We ask that you please keep your microphones on mute and that you type your questions in the question and answer section rather than the chat section. And today's topic, a toolbox for the mind, the art of healing stress, anxiety, and depression. Dr. Nadia Ali, she is the founder of Functional Integrative Medicine Practice, Functional Holistic Healing. She's been practicing for 18 years, board certified in internal medicine specialty, board certified in integrative holistic medicine, board certified in the American Board of Integrative Medicine, a fellow of the American College of Physicians, a member of the Institute of Functional Medicine, and she has certificates in the areas of nutrition, mind, body, Ayurveda, and Chinese medicine. You can learn more about her practice at www.theholistic.healing.org.
Thank you so much, Kathleen. What I want to do is I want to start with a video clip that I want to kind of show you. So let's go ahead with that. It's a story which is very interesting. It sheds light on a number of aspects of mental health. So let me go ahead and share this screen with you. So Laura is one of my patients, but more importantly, I think she is somebody who I admire for her ability to be able to stay persistent. You know, I mean, if there is one word that describes her, it's a person who would not give up. And I think that sometimes if you want to achieve something, you have to be persistent. You have to constantly pursue, and you have to ask the right questions. So she's a mother of 3 kids. She is a really amazing mom. And I'm impressed with her ability to smile with all the work that she does. She's a former teacher, and she's very passionate about helping others battle their health issues. One of the reasons, probably because of her own health issues that she has faced, you know, she is much more compassionate and empathetic towards people who actually have had, you know, similar issues to her issues. So, and one of the reasons why I wanted her to share her journey is because I have found her to be somebody whose work who's worked very hard in areas of, mind care. When we talk about tools, it's very easy to talk about tools. I mean, as a prescriber, it's very easy for me to prescribe, but it's very difficult for the patient to actually be able to take the tool when they're actually surrounded by a lot of other issues that they also have to deal with. And I think she did a phenomenal job with that, and that's why I want to go ahead and talk to her about her story and have her share her story. And I'm very grateful that she has decided to do that. So my first question to you, Laura, would be, tell us about your anxiety. How did you feel when you were anxious, and how did that affect you?
Okay. Well, I'm very familiar with anxiety because I've always been anxious. Like in kindergarten, I had headaches and the doctor said, I think she worries too much. So it's in my history, but I matured, I grew, I learned strategies, and I never had like latent anxiety that needed treatment. But the negative thinking and the overthinking and fearful thoughts were like very ingrained in me. I put a lot of pressure on myself. I was a perfectionist. And then I had 3 children in a very short amount of time. Brain fog was like masked as mommy brain. I must be mommy brain for a few years. I didn't realize the extent of all that, what I was feeling, like the tense in my stomach, the knot in my stomach, the brain fog, the busy thoughts. I didn't realize they were not normal because they felt normal to me. It's just how I've always been. But anxiety increased as my second child was born with special needs, and just life was difficult. There were some circumstances I was going through. And then I had another child, and she was a strong-willed little one, and I wasn't expecting that. So I was trying to keep up with life, just life got really different really quickly. And then just trying to keep up with the pace, like play dates and tutoring up children and babysitting other children, trying to make money, hosting people at my house, library times, good things I enjoyed. But over time, it felt like I was enjoying them less and less. Whereas packing to go on a trip was like very overwhelming to me. So the joy was being drained because of the anxiety and the feeling of being overwhelmed. So then I started feeling a lot of fatigue, and mostly in the middle of the day. When you have 3 kids under 4, that's not good. And then later I learned that my adrenal glands were totally drained, because my body from childhood was really quick at shooting out cortisol because of just this place of anxiety I just lived in. So I felt really tired, and then I would get a second wind right when you're supposed to go to bed, which is classic adrenal fatigue, I later learned. And also my moods were terrible. So it was rough, but it was my norm. I didn't realize it wasn't normal at that time.
I think you raised an important point. I think actually a couple of points. The first being that most of us, because we have some degree.
Thank you so much for sharing.
Kathleen, did you hear the clip? Were you hearing the clip or not? Because I think I got some messages that they could not hear the clip.
I was able to hear it, but I wasn't able to see it.
So let me share again, because the clip is not finished, but I just had to stop it just to make sure that you are able to see it. Can you see it now?
I can see it now.
I'm going to start from where we left. Degree of anxiety, and because it slowly creeps on us, we don't realize that it's not normal.
Right.
And then we identify that as that's me. That's how I've always been. But that's not necessarily true. And the other thing which I thought was very interesting that you said was that as your symptoms progressed, and this is where we talk about when do you feel that this is a problem, is when all that you enjoy is now becoming a burden for you, and that's when you should really stop and kind of ask yourself that, is it really fun? I mean, and why is it not fun, since it was fun at one point in time?
Mhm.
So I think the right questions that you asked. And so then let's move on to, because remember that anxiety is not just a matter of the mind, which is unfortunately how we think about. Tell us about how this anxiety affected your gut and how did it affect your food choices?
Okay. Um, so my gut was also always an issue, a problem. Like, it wasn't a healthy gut, but I didn't realize it. Again, this was just my normal. But with the constant stress, it wasn't helping the bloating I felt. Sorry, can you see me?
Yeah.
The bloating I felt, and the tension that was like always there. It's like I felt like I needed like to belly laugh to relieve tension, which didn't happen very often because I was so intense. um, but yeah, so I had, even as a teen, I had incredible gas pains. I had bloating that I would just want to like lay on a pillow, and I just took tons of Tums in my early 20s. It's just not normal. But I didn't realize it wasn't. So I did start trying to take care of my gut through just learning on my own. I could not find help in the medical world, no answers. So I did the paleo diet on my own for a while. And with my limited knowledge, I tried to like take care of it, but um, I was so busy in my life that I couldn't spend a lot of time thinking about my belly or my gut, and I didn't know what the root cause was. And then also, when you're moving so fast, you might be making a healthy lunch for your kids, but you're running out the door with like 3 pieces of cheese, white bread, and some chocolate for yourself. You're not you're not taking care of yourself. And also, I had candida in my stomach, in my gut, which I didn't know at the time, which was craving sugar. So I was just going with my cravings, and I had always tried to be a healthy person, but I had limited knowledge on what that actually meant. And I didn't know about all of these things. So yeah, the stress just added to the bad choices, just came with the pace and just the weight of everything. You just don't have time to take care of yourself.
I think that's the key. That's the vicious circle that we talk about. That, like, you start off with anxiety and then you make the wrong choices, and then it affects your sleep as well.
Yes, right.
So, and then it goes on and kind of increases further stress, and then you just keep on going, keep on going, keep on going. So
Yeah.
that's what it sounds like that you also were in. So
Mhm.
so let's talk a little bit about, how did you find anxiety affected your hormones?
Okay. In my early 30s is when I was having babies. And so I thought it was just my age, just having kids, I must be getting older. But most months, I had 1 week where I had some relief from real crazy swings in my emotions. I would snap at my family, was angry, I was super negative. Um, Lots of like tears and angry outbursts when I didn't want to, but it was just I didn't know that some of it was out of my control. Like, I didn't know how much hormone imbalance was playing a part. I just thought, wow, I don't even know what I thought. I didn't have time to think much about it. It just was what was happening. So, and then the brain fog, I couldn't remember not having brain fog. So I lived in this foggy, anxious world where my emotions pretty much controlled me.
Right. And I
Yeah.
think that's the sad part, that, like, if you have only 1 week where you actually feel sane,
Yeah.
you have 3 weeks when you're insane, and you have 3 kids to take care of.
Yeah.
How are you supposed to do that? And that's why I think I really have a lot of respect for people who actually been there, done that, not because it's their fault, but because they could not find help, and nobody could make them sit down and say, hey, listen, you don't have to be that miserable, and what you're feeling is certainly not normal.
Yeah.
So then let's then talk about your healing journey as to, like, when did you decide that, look, enough is enough and I can't take this anymore and I have to do something? And were you successful? And how
Okay.
did you make sure that you succeed in this job?
Okay. Yeah. When my youngest was 2, we had just moved into a new house, and I had started having some joint pain, and the fatigue I mentioned, all of it increased very quickly. My hips were really sore. I couldn't put pressure on my hips after I would be sitting for a while. So basically, when the joint pain got worse, the fatigue got worse, where I wanted to cry thinking of walking up the steps. I thought something, and then my gut was always a question, like something is wrong. I couldn't function anymore. So I had to seek help. And I got some blood work done, and it started the journey of what's wrong. And it was a very long, hard journey. Through in and out of the medical specialists and then wellness centers and trying to find the root cause. I learned that I had autoimmune issues, multiple infections, Lyme, severely leaky gut, hormone imbalances, extreme nutrient deficiencies, and just a lot of inflammation. So I had to tackle this holistically. We worked on diet, exercise, stretching, strengthening, supplementing to make up for what was lacking, and then eliminating what my body wasn't eliminating on its own. And then dealing with what was in my mind, and how, kind of holistically getting my body in line so that it could heal. So that was 6 years ago that I started that. And I started taking deep breaths, which sounds silly, but I never did that before. Praying, meditating, journaling, exercising. The first time I did yoga and actually took deep breaths, I was tingling because my body was like, oxygen? It just felt, it doesn't happen anymore. It was such a weird experience. So my brain was foggy because my gut wasn't absorbing fat or nutrients, and everything was inflamed. So my brain was affected. My hormones were affected. I worked with doctors to deal with stuff one thing at a time. And then when I found you, Dr. Ali, I was still dealing with a lot because there were some root issues that weren't exposed yet. So Dr. Ali helped me find a mold toxicity and some other gut infections. And we started IVs because I was so deficient. So even though I was eating kale and all the good stuff, my body wasn't getting a lot of it. So she also asked me to keep a journal, which I've done off and on, but in the last couple years, I had not. So, and she gave me some specific points to journal, which really was helpful. So I journaled about what I'm thankful for. I journaled things I'm fearful about. I journaled what the truth was to match up with those fearful thoughts. What's the truth about this situation, about this thought? So that was really helpful. And I had learned a little while before that we have neurological pathways in our brain, and we get stuck in a rut thinking one way, and that you can actually build new neurological pathways. And Dr. Ali reminded me of that. And so I had success with this in one thing in my life. So I practiced it with other things. And it really feels good to do work like that in your mind and see results. So that was good. And I had to look at my health in a new way because I was so scared. I mean, this is a scary thing to go through. So you got someone with anxiety that's dealing with my body shutting down. I mean, that was felt like that. So I had to be positive and tell my body, you can do this, and just speak. I had, scripture speaking that over myself. So a lot of it was in my mind. The journaling helped. And then I had people like Dr. Ali, my husband, some friends telling me, you're speaking out of that old rut. You need to shift to this new way. What's the truth? So the other thing I did was I changed my pace of life. I had to say no to a lot of things. I'm a type A person, but I've always led everything and felt like I had to do everything. So it was hard for me to, especially when you look around at America, everyone's doing everything. And I felt like a slacker for a while because I had to be like, no, I can't do that. And so now my life is more simple and it's not a bad thing. And you need to know yourself. You need to know your boundaries. You need to know when your body's trying to say it's enough. So I've seen a major difference in myself. I'm more present. I'm less afraid. I'm more positive. I'm less tired, less agitated with my family. When I am agitated, I know exactly why. Oh, I overdid it, or my hormones are acting up. Why? I talked to Dr. Ali about it. I'm more aware of myself, which is good. And when I push it, the old symptoms come back. Like I feel the joint pain. I feel the bloating. I feel foggy in my brain. So I feel more irritable. It's harder to get back to sleep if I wake up. So I'm getting better. I'm not perfect at any of this. But taking deep breaths is huge. I'm getting better at that. I teach my kids how to do that. So yeah, I try to exercise. I try to do yoga. I take salt baths every night, even though the water bill is probably too high. I started doing that because of the pain, but now it's like something I do for myself. It's my time to be like, okay, like take a deep breath and relax. Some people are better than doing that than others. Like some of us have personalities that might need a little more help. But I don't want to take on that this is just who I am. I can be a peaceful person and there's hope. So yeah.
Thank you. Thank you so much. I think the biggest and most important thing that you have learned, and I think when we talk about prevention, that's what we talk about, that how do you equip that person with the tool and the ability to sense what's going on? When you say that you talk to yourself, you're not just talking, you're also listening to yourself at the same time. And so once you have that tool, like you're saying, you can see, when you are getting overwhelmed, you can stop yourself. You can say, okay, this is what's causing it. I'm going to do this differently. Then you don't really need a physician to every time intervene, because you have now become your own physician, because your body is talking to you. You don't need a new test to tell you what's going on. And I think that really is where we say prevention is, that when you have a direct connection with your body, where the physician is not desperately trying to do tests to find out, okay, what's going on and now what new intervention we have to do. And that is the key to prevention. And what you have learned, not only will you teach that to your kids, but this is going to stay with you lifelong.
Right.
Which means that there is nowhere down the road when we expect you to have to see a psychiatrist for anxiety.
Right.
Because now you are your own psychiatrist.
Yeah.
So I think is what, when I say that I really feel you've done a great job, it's because you have the tools now. So nobody is perfect. And I don't think anybody can predict that, oh, my life will not have a, major issue at such and such point in time. But the question is, can you say that if you have a major change in your life, do you have the equipment and the ability to overcome it? And if you can say, yes, I do, then basically you're saying that I can prevent a disaster.
Yeah. Yeah, because I feel like my story is a perfect example of the perfect storm. Like this added to this, which added to this, and you want to prevent that if you can.
Definitely.
So, yeah.
So
Yep.
Thank you so much, Laura, for your help. And we really appreciate you sharing your story with us. And I hope that people will be inspired and would have definitely gotten something that they can also do, to help their own situation.
Yes. Well, thank you. Thank you for all your help.
I love hearing the stories, and I have to say, Laura's story has to be one of my most inspirational ones. I got to hear it at the beginning of my healing journey, and it's been night and day. And I really liked when she was speaking about like the neural pathways and going down, and you can create new neural pathways and new ways of thinking. But also, I want to reflect a little bit of labeling like stress as bad or good, because we all have stress in our lives. So can we label stress as bad or good?
So, there is a graph here that I wanted to show you, and this is a very classic graph that we do need some stress in our lives. Because if we don't have any stress, we don't have any incentive to do anything, right? I mean, there is no reason to work, and there's no reason to worry that we won't have any food or that we have to pay bills. So the stress is needed. But the problem is that, and it actually helps us achieve optimal performance. However, when the degree of stress, goes beyond a particular level, that's when our performance actually drops. Now, two things can possibly happen. Either the amount of stress is too much. And when is that? So it is like if you have a life threatening situation, you are in front of a lion. There is death in the family, there's divorce in the family. Those are really events which are extremely stressful, and they are kind of life threatening because you are beginning to think, can I survive this change or not? um, Now when that happens, you do expect that there will be an increase in stress level, but that stress level is supposed to go down within a matter of 3 to 6 months. That's what we call the grieving period. But if that does not happen and it continues, then that's definitely abnormal. So that's one possibility. The other possibility is that, as Laura said, that she used to enjoy certain things, but now they have become a burden. So that's a second scenario where what's happening is that the level of stress has not changed. There is no excessive stress that you're encountering, but your body's ability to deal with stress is actually going down, which means that there's something going on which is affecting your brain's ability to function. And that is when you should be concerned that why is that happening? And a third scenario where you can actually say that stress is a problem is I see patients who come and they are in denial. They say, I don't have any anxiety and I don't have any stress. However, I have a mind which does not stop. I mean, if I wake up, I'm still thinking about something that's going on in my life. And that is anxiety. And that is definitely not normal. Not to be able to disconnect yourself from what's going on around you is a third scenario where I would say this is pathologic or it's an abnormal anxiety, which can be disastrous.
So, how common is mental illness?
Unfortunately, mental illness is extremely common in US, and 1 in 5 adults, and this is a data from 2019. We know that it is on the rise, so this may have changed, but we're talking about over 51 million people suffering from mental illness. Unfortunately, it's higher amongst females, and the group that's most affected by it is the younger age group between 18 and 25 years.
And so often we hear mental illness, we think about the brain and we think about the brain health specifically. Is mental illness really all about the brain?
Unfortunately, not. We often think of mental illness as a problem with the brain. That's not the case. Mental illness affects literally every single organ system in the body. It is a very important cause of disease, and it's a very important cause of symptoms. And it also has the ability to reduce our lifespan by as much as 3 years. And that is huge. So if you have mental illness and if you are not taking care of it, not only are you at risk of developing diseases, you are also reducing your lifespan. And this picture here is actually pretty obvious in terms of what can stress or mental health do. It can cause digestive issues, heartburn, irritable bowel syndrome, obesity, but it can affect your heart and you can get high blood pressure, you can get a heart attack, you can get a stroke, you can also get high cholesterol. Interestingly, it also affects the skin. So you could have acne, you could have eczema, psoriasis, rosacea. A lot of these patients would complain about shortness of breath, but their workup for the heart would be negative. Um, we also know that people who have mental health are at increased risk of diabetes. So they're twice more likely to get diabetes. We also know that they have a lot of reproductive issues. Infertility in women, is one of the areas where you have to look for stress. There is reduced libido. Women who have stress will have a lot of PMS issues. This also affects our excretion system. We know that these people have increased urinary tract infections. They have bladder inflammation, which is called interstitial cystitis. There is incontinence issues in women who are stressed out or who have mental illness. They also have a lot of fatigue. And, Laura talked about fatigue. They have brain fog. They have muscle pain, joint pain. They are also at increased risk of osteoporosis, weak bones. We also know that these individuals have other symptoms which are related to their nervous system, such as migraines, headaches, memory loss, and of course, sleep issues. We also know that these individuals are at increased risk of infections because it affects the immune system, and they're also at a higher risk of autoimmune diseases. So it's kind of really sad that this individual who we think is only having a mental health issue is an individual who is at risk of a lot of diseases and symptoms. And then there is another relationship that once you have mental illness, and that increases your risk of disease, but then when you have the disease itself increases your mental health issues. And so clearly this person is actually in a vicious circle, and they can't get out of it because there's one problem after the other.
And, we got to figure out what to do with this vicious circle. And so I'd like to ask, how does conventional medicine approach mental health concerns?
So conventional medicine has two arms. The first arm is talk therapies, and this is the arm that is outstanding. There is a lot of data. It's very effective. It does not have any side effects. And there are lots of different types of talk therapies. And if somebody has a mental health issue, I always tell them that the first thing would be to see if you can talk to somebody about it. And so that is one arm of the treatment. And there are many ways to approach, the talk therapy. Again, you have to find first the right therapist and then to know the right therapy. Because remember that I have seen a lot of patients who would come to you and say, I have a therapist, but it's not working. And that's not because there's a problem with, the therapy itself. This could not be the best match for you in terms of the therapist. Or it could also be that you have things other than just a mindset issue that's going on. So you have to think about that as well. The second arm of it is medications. And this arm is an arm which has a lot of issues with it. So I'm giving you SSRI. This is a class of medications, a selective serotonin reuptake inhibitors. This is one of the commonest medications used in mental disease for mental illness. And there are two issues when you use medications. The first issue is side effects, and the second issue is polypharmacy. And we will talk about both of these in somewhat detail. So there was data that was collected in 2017, and they found that 1 in 6 American takes a psychiatric medication. Now, this is something which is very concerning, and I'll tell you why I'm saying that. And they found that the people who are taking these medications, 67% of them were taking SSRIs. So if we look at the side effects of SSRIs, these are some of the side effects, like there's digestive issues, and there's loss of appetite, weight loss, weight gain. There is dizziness, there's drowsiness, restlessness, sleep issues. You could actually be sleepwalking, which can be actually dangerous. And of course, sexual dysfunction is another possibility. But then these are not necessarily the most serious side effects. Here are some of the serious side effects. There's physical dependence, meaning it's very difficult to get off of these medications. When you start these medications, your risk of suicide actually increases. Your risk of violent behavior actually increases. And that is very concerning, because if a depressed person has increased suicidal ideation, then we realize that it could be disastrous. There is 3 times increased risk of diabetes. There is risk of high cholesterol. There is risk of memory loss and inability to function. In pregnant women, we know there is twice the risk of stillbirths, 2 times versus somebody who's not taking it. There is risk of osteoporosis. And this is the part which is really, really sad. There's 33% higher risk of death, you know. And if you are depressed and you take this, there is a risk that your depression may convert into mania or bipolar depression. So it is true that stress and mental health also causes a lot of issues, but it appears that the remedy that we are using for it also has a lot of issues. The other thing I said was polypharmacy. And this is really interesting and actually, to be honest with you, very sad. This is 1996. They've looked at data and then they've looked at 2006 to compare what was happening over this course of time. And what they're saying is that 40% of people were using more than 2 medications to control the disease. And this number went on to 60% by 2006. Then there was people who were using more than 3 medications, around 16, 17%. It went all the way to like 30%. And then there were those who were using more than 4 and 5 medications, and that also increased over time. So if one class of medications is causing so many side effects, and then you combine it, you can just imagine what kind of side effect spectrum you're looking at. So this is an approach. So sometimes you have to take medications. You may be at a point where you have no option. And it's all right, you know, because of survival purposes, we may have to take these medications for some period of time. But our goal should be, what can I do to get myself off of these medications? Do I need to do talk therapy? Do I need to find out what is the cause? Why is it happening? So, but this needs to be kept in mind when you are getting any kind of medication, as to, what is the spectrum of the problems associated with it.
And it sounds like the medication can kind of be helpful in getting out of the cycle of overthinking in times when you're really at that point. So I want to kind of ease into, is the conventional approach effective?
So I think that is another area which is not necessarily most promising. There was a STAR-D trial. This trial actually shook the world of psychiatry. This was the largest prospective trial carried out for major depression. It was carried out throughout US, and there were 14 university centers who participated, including 23 psych clinics and 18 primary care clinics. It went on for about 4 years, and they had 2,876 participants. And when they looked at the data, it was terrible. They found that people who were given first-line therapy, they only were successful 27% of time, which means there was more than 70% of people actually failed the first treatment that was given to them. Then those who failed went on to the second line of therapy. And again, those people who went to the second line, only 21% were successful. And then when they failed that, then they went to the third therapy and only 16.2% were successful. And then they went on to the fourth and only 7% were successful. So what you see here is that the success rate with every failure actually increases. Sorry, the failure rate actually increases with every failed attempt. And that definitely is not looking very good. So clearly, we need to find an approach which is more promising and definitely with less side effects. And that's where we talk about a functional approach. And that is why there's a need for a functional approach.
And so what are some of the approaches that functional medicine takes?
So, when we talk about a functional approach, the functional approach is a root cause approach. Meaning, if the first question, like for example, if you heard Laura's story, she talked about a lot of things. She talked about the gut not working and she talked about the hormones not working. So, clearly, her anxiety and her brain fog were a result of other things which were going on because her life was pretty stable. I mean, she didn't have any life threatening issues. So that this approach, the functional approach, is also individualized. You want to make sure that everybody will have a different story. You can't treat all of them with the same supplement or the same drug. And the third thing is, in a functional approach, the idea is that you are not trying to treat something, you're trying to heal the person. And healing does not come from the physician. Healing comes from within the patient. So the approach is, how do you get the patient to heal? And that is why in a functional approach, the leader is not the doctor. The leader is the patient because he is the one who leads. He is the one who listens. He's the one who communicates with his body. So it's like an onion. There are many, many, many layers. When we live our life, every single point in time in our life, we have new experiences. They could be physical experiences, they could be spiritual experiences, they could be emotional experiences, and they change the way we look at life. They change how we look at our health. They change how we prioritize things in our life, and they change what kind of exposures we have. And the goal of a functional physician is, can he or she actually create a map of exactly what those exposures were, help the patient understand why they're feeling what they're feeling, and then help them overcome the issues that have happened over a course of time.
So once you've looked at everybody or the individual story, I guess I want to know, what exactly is the first step for the functional approach to mental health?
So the first step is listening. And I think this is where I have found that, the place where we lost the game in conventional medicine is that we don't have any time to listen. But that is the most important step. And I can tell you, as a functional physician, sometimes I had to listen to a story 30 times only to then be able to figure out what is going on. Because a lot of times, even the patient is not aware of what's happened. And one of the areas which is very important, particularly in the field of mental health, is trauma. And when I say trauma, I don't mean somebody has gone to the war. Most trauma does not happen simply because you go to the war. There are a lot of people who have been traumatized throughout their life at multiple points, and they don't even realize how those incidents have affected them. So there's a study which is considered the gold standard in the field of psychiatry. It's called the ACE study, Adverse Childhood Experience Study. This is a study which was really mind blowing. It was a study which looked at traumatic incidents that were experienced by children between 0 to 17 years. They either experienced violence or abuse, or they had a member of the family who actually attempted suicide. And this study was carried out between 95 and 97 with over 17,000 participants. And the study of these results were mind blowing. We found that these children who are exposed to these traumatic events, they were not necessarily events that happened to them, they could be witnessed by them or happening around them, actually made these kids much more likely to have depression, anxiety, PTSD, have addiction issues. These people were more likely to have HIV, STDs, cancer, diabetes. These individuals actually were more likely to not have achieved the degree of success in life that is expected from others who were not exposed to that. And so it's very interesting that these kids actually had outcomes and they did not have any control over the exposure that they had. And so, a lot of times when we are working with patients, we find that they're not aware of what they have experienced. They have no idea how the experience has changed their outlook. And then that actually has consequences later down the road.
So for the next few questions, I'm going to ask you what roles do different systems play in mental disorders. So for instance, let's start with the digestive system. What role does the digestive system have in stress, anxiety, and depression?
So there are two, parts of this answer. The first is that the gut actually has a brain of its own, and that is what we call the enteric nervous system. And this brain is very powerful. Neurotransmitters is the name of the chemical messengers in the brain, and we know that this second brain, you can call the first brain in your skull, the second brain in your gut. The second brain uses more than 30 neurotransmitters. And these two brains are actually very intricately connected. So if you look at serotonin, serotonin is one of the chemical messengers that's used in the brain. It's one of the messengers most implicated in mood disorders, and most medications actually try to increase serotonin one way or the other. We know that 95% of serotonin actually is present in your gut. So we know that if this second brain does not work, it will make sure the first brain is not happy either. So they are twins and they really affect each other. The second part of this answer is that the gut has a lot of bacteria, and these bacteria are extremely powerful. And what they do is they manipulate the second brain to get the message to the first brain. So these bacteria are so powerful that they actually have been shown to physically change the structure of the brain. They have the ability to make the brain release chemicals like BDNF, which stands for brain derived neurotrophic factor, which can improve your memory. They actually can release toxins, which can cause inflammation of the brain and mental illness. So basically, if you look at these bacteria, they are so powerful, then they can pretty much change any and every aspect of the brain. And that is why, the gut is the key, especially in somebody who says that, I don't have a life threatening situation going on, but I don't know why I'm depressed all the time or why I'm anxious. You definitely want to see if your second brain is what's kind of shaking and pulling everything.
And so many times, that second brain is what is absorbing nutrients. So, what is the role of nutrient deficiencies?
So that's a third way in which the gut affects the brain, that there are certain nutrients which are key nutrients like vitamin D, omega 3s, vitamin Bs. These are key nutrients which are needed for the function of the brain, for formation of chemical messengers in the brain, and for detoxification of the brain. And if the gut is not functioning, you are not getting these. And if you're not getting these, it does not matter how well you eat. Like Laura was saying, she eats really well. A lot of people we see, they come to us, they say, I only eat organic, I go to Whole Foods. And a lot of times we have to say, so what? Because it does not mean anything if the gut is not doing its job. You will have to fix the underlying deficiencies, and you will have to fix the gut.
And a lot of times, if you don't have the right nutrition, then you can't really build hormones. So what is the role of hormones?
So, actually, if you look at the brain, you can think of the brain as swimming in hormones. So the brain has a lot of receptors for hormones. So, and they could be cortisol, it could be thyroid, it could be the estrogen, progesterone, testosterone, it could be insulin. So when you are looking at, mental illness, you always have to know if there is a hormonal imbalance underlying. For example, we know that people who have blood sugar regulation issues will have mental health illness. You know that a woman who is perimenopausal may often complain, I feel anxious, I feel irritable, my memory is not that good. And so that hormones play a really important role. And so hormone imbalances is one of the things that we have to assess when we are looking at somebody with mental illness.
And what role does the immune system play?
So I think this is one of the very interesting aspects which has come to our attention in recent times. What we now know is that in the brain, there are certain cells. They are called the glial cells. Now, these cells actually are the immune cells. They are supposed to fight infection. They're supposed to fight toxins. And when a lot of infection is coming inside the brain, or a lot of toxin is entering the brain, these cells become very active and they start releasing something called chemokines. These are chemicals, okay? And these chemicals can cause inflammation in the brain. And when that happens, then the brain becomes really inflamed and starts to malfunction. And then there is also another role that these cells play, which is the role of detox. So there are lymphatics in the brain called glymphatics, which are supposed to get rid of the toxins. So if the glial cells either not perform their function or do more than what they're supposed to do, in either case, there is going to be suffering of the brain tissue and ultimately symptoms related to that.
So what about like other bacterial infections? Because a lot of times we have like candida. So like bacterial and fungal infections. What role do they play?
So, like I said, there are a lot of infections that directly affect the brain. Now, it could be candida, like, Laura was talking about. It could be mold. It could be Lyme, herpes. It's actually a viral infection. Syphilis is another bacterial infection. And there are many other infections, which have the ability to get to the brain. So, if you are not going to be able to identify these infections, because as soon as the infection reaches the brain, it activates the immune system. And if the infection keeps on going, the immune system continues to be activated. So it's not really the fault of the brain that it's showing these symptoms. It's just trying to tell you that, listen, I'm under attack and I need help. It's basically a help signal that's manifesting itself in symptoms.
So those are living. Do non-living environmental toxins ever play a role?
There are lots of environmental toxins which actually affect the brain. Mercury is one of them. And you know that we talk about silver fillings, which has mercury. Lead plays a very important role. Pesticides, they actually can enter the brain. The other chemicals like PCBs, these chemicals are present in plastics. They're present in dyes and paints. And when we are exposed to them, they actually can go all the way to the brain, and they can cause a lot of mental health issues. It's very interesting when we say that mental illness is on the rise. At the same time, we know that the pollution and toxins are on the rise. So maybe we should think about, could there be a correlation? And imagine that, if this exposure is happening to a little tiny brain that's forming in a mother's womb, that baby is going to have ADHD issues. We are seeing ADHD on the rise. That baby will have autism issues. There will be low IQ. There will be developmental issues. So not only because of the toxicity are we killing the brain when we're adults, we might actually be causing damage very early on as well. So it's really, really, really important that we look at toxicity around us.
And we hear so much, live a detoxifying lifestyle. That's the wording I'm hearing around the internet. And it almost seems hard to kind of avoid some of these environmental toxins that are sprayed on our food or put in our soaps. And it seems like it's everywhere. So I want to kind of hone in on, what can I do today to improve my depression, anxiety, and stress levels?
So, the first and foremost thing that I have to tell you is sleep. Sleep is the key. Sleep is when the brain actually detoxes. And so what you want to do, you want to have to sleep at the right time, which is anywhere between 9 and 10. The most would be between 10 and 11, but certainly not beyond 11. Ideally, anywhere between 9 and 10 or 10:30 at the most. And you want to make sure that you get up on time. You have at least 7 to 8 hours of sleep, uninterrupted sleep. That is your goal and should always be your goal. Remember, the devices actually reduce your melatonin release. So definitely devices are supposed to be off 2 hours before you go to sleep. So the first thing is, can you preserve your sleep? Number one. Number two, anti-inflammatory foods. Foods such as salmon, nuts, all types of green leafy vegetables. You know what, how much anti-inflammatory food is in your diet plays a key role in how the brain will function. Third and very important thing that I would say, this is for everybody. You don't have to do this if you have a mental illness. Everybody needs this. We need a mind body technique that works for us. And Laura was saying she takes these salt baths, and she loves it, and that works for her. So that's her thing. So you can look into yoga, you can look into Tai Chi, you can look into massage, you can look at acupuncture, but this has to happen every day. You can do guided meditation every day. And now that the weather is getting better in Northeast, nature is actually a stress reliever. And even if you don't want to walk, just sit in the sun for a half hour, 45 minutes. You will see your mood gets better. You will hear the sounds of nature. And we now know that there's a concept of forest bathing. This is a Japanese concept where physicians actually write prescription for the patient to go to the forest. They give you the exact forest they want you to go to, and they tell you exactly how much time you need to spend there. So that's free stress relief. And then last but not least, avoiding toxins. Yes, we cannot avoid all toxins, but we can avoid toxins that we know of, like, what we apply on our skin, what we apply on our nails, what we put on our head. So I think that we have to start looking at labels, and we have to understand that, we are damaging ourselves. So those are the things which can happen today.
So in order to get some of those things to happen, I wanted to kind of ask, what are some of the tools used in functional medicine when addressing mental illness or mental illness concerns?
So there are lots of tools in our practice that we use. We use fasting as a tool. We use nutrients as a tool. We use bioidentical hormones as a tool. And remember, everybody does not need every tool. You have to customize. And what Laura did, there might be another person with exactly the same symptoms, but they may not really like to do what she did. And it may not be the best fit for them. And that is the role of the functional physician, to find out what is the tool that would work for you. So you pick the tool. Usually it's more than one tool that you do. You combine the tools together, and then you help the person to kind of tweak that tool according to what their needs are, and then go with that.
Thank you so much, Dr. Nadia Ali. So I want to introduce our new segment, Blue Zone. Hold on real quick. Introducing Blue Zone Functional Lifestyle, where I'm going to go ahead and ask Dr. Ali, what are these segments going to be on, and what are they going to look like? What are they going to be about?
So basically, blue zones is a term used for areas where people have lived longest and healthiest, right? So if you want to live longest and you want to live healthiest like these people had certain principles that they followed, and the functional medicine actually provides you the tools so that you can achieve those principles, whether it be about your diet, or whether it be about sleep, or whether it be about how do you avoid toxins, or what kind of nutrients you need. And so the segment is there to tell you how you can incorporate some of these principles into your life. What are some of the ways you can do that so you can stay the healthiest and live the longest?
Awesome. So I'm really looking forward to hearing some of them and presenting with you. So if anybody here has any questions, hold on real quick. If anybody here has any questions, please feel free to email us or send us a message or a DM a direct message or even a private message on Facebook or Instagram, and you can share some of your healing journey or any questions that you have. I'm going to go ahead and ask a couple questions. If you have any questions from today's webinar, please go ahead and take the time to type them in, and I'm going to go ahead and look at some of them right now. So the first one is sleep. You're mentioning sleep. If you're waking up from pains or a digestive tract, how can you fix your sleep?
The first thing is to be able to identify, what is the source of pain. If it's GI pain, clearly it has to do with what you're eating at dinner time, or it could have to do with the gut bacteria. And so you need to fix that before you can go ahead and sleep better. So that's the whole idea, that before you fix your sleep, you have to fix your gut.
And also, if you're on an SSRI, can you hear your body when you're on an SSRI? So I think they're asking about.
Right. So this is a very interesting question, and whoever has asked this question is really smart, because they kind of know how SSRIs work. SSRIs actually mask emotions, right? And so what happens is, a lot of times, when you're on the SSRI, you almost feel like you're a zombie, because you really are. You don't feel any emotions, right? But what happens is that despite the fact you may be on SSRIs and you may not have any emotions, there will be bursts that you will see, that at times suddenly you become sad, or you become anxious, or you become irritated, or you become agitated. So that's telling you that what's happening is that, your body is still trying to tell you something. And I agree with you that if you are on SSRIs, your symptoms are going to be masked. So you're not going to be very good at communicating with your body, even though you may have some outbursts. So a lot of times what we do with our patients who are on SSRIs and who want to get off of them is we would actually figure out what is the degree of inflammation and what is the degree of nutritional deficiencies, which could have actually caused the problem. And once we fix that, then we start reducing the SSRI. So when we fix that, the patient will tell you he or she does not have those bursts that he or she used to have in between, even though he or she was an SSRI. And that's a really good signal. It's telling you that the patient is feeling really well. And then the patient actually is going to feel very confident about getting off of the SSRIs, because they also realize that, they don't feel the same way that they did.
Thank you. And that looks like that can, I think there's a couple extra. Do you have any specific treatments for inflammation and joint pain? I do know that there's a 15-minute consult link that I can send. But Dr. Ali, is there anything right off the bat that you think of?
So when somebody has joint pain, remember that joint pain may not necessarily originate in joint. That's the other thing to know, right? So remember that a lot of times you may have an inflammation in the body somewhere else, which is manifesting itself as joint pain. And yes, you can give them, you can say, well, we can give you some supplements, which can help you with your pain. But what you're doing is you're putting a Band-Aid, because you also don't know why you're having the pain, and your doctor does not know, and he will tell you go take ibuprofen or something like that. But really, nobody knows why you have the pain. They're just treating you because you're complaining about it. So in a functional approach, you don't just go ahead and throw stuff at symptoms. You first want to determine that, where is this pain coming from? Is there inflammation, and what is the degree of inflammation? And you treat that. And when you do that, then you will actually remove the source of the pain instead of trying to do symptomatic remedy.
Thank you. And there's one other question of, how do you test for leaky gut? And I wanted to let you guys know that I did post the YouTube channel link for our leaky gut webinar.
So there is actually a blood test that can be done for leaky gut. And basically what you're doing is you're looking for antibodies. So when the gut breaks down, what happens is that parts of the gut, of your own gut, actually enter the bloodstream, which they are not supposed to enter. And when they do that, the body is kind of surprised and says, oh, who are these little creatures? They're not supposed to be here. And so it starts attacking them. And that's why those antibodies are there. And we check for those antibodies to tell us, if there is leaky gut and what extent of leaky gut is there. And that's how we determine if there's leaky gut or not.
Awesome. Well, that concludes, looks like there's one more. I'm going to take this as our last question, and then I'm going to go ahead and wrap up since today's so beautiful outside. Are allergen toxins, and I'm struggling to read it. It is in the chat box.
Come again?
It says, are those Invisalign aligners toxic?
Oh, Invisaligners toxic. So remember that, when you have those Invisaligners, they usually try to make them with the material which is not supposed to be toxic. But remember that any material that you put in your body, like for example, when we replace joints, we put titanium, right? Apparently titanium is supposed to be hypoallergenic, but there are people who actually react to titanium. And so you may put something inside thinking that it is not going to be a problem, but for that particular individual, is it a problem or not? You won't know. And so, unfortunately, I'm seeing a lot of teenagers now who have these, Invisaligners or whatever you want to call them, inside their mouth when they did not necessarily even need it. And so I think that before you put in anything, you want to make sure that you really need it, number one. And number two, you want to make sure that there's a time duration. It can't be that you're supposed to wear that for like 5 years. I mean, that's really a long time. Maybe a few months, maybe a year at the most. So you have to have some kind of a duration that you need to follow, because you don't know how your body is going to react to that material, because that material is actually non-living. And so of course anything which is non-living is inside the mouth. You eat, food gets stuck around it, inside it, on the sides. Are you cleaning it well? Are you not cleaning it well? I mean, there's so many things that there are questions that we don't know, and as a physician, I don't even think we have answers to those questions, because I don't think that those have been studied very well. So yes, apparently it's not made up of mercury, so I mean there is no direct toxicity that we know of. But I have actually heard stories where somebody said they got something, put inside their mouth because they had a TMJ issue. They bought like something that would help them. And after a week, they had major issues. So it's very hard to predict, what can cause what, because we don't know how your particular body will respond to a particular element, that has been placed inside your mouth.
And so many times we react to natural elements, man-made elements, I can imagine. Thank you so much, Dr. Nadia Ali. Thank you. And thank you everybody else who is here and live with us.
Thank you all.